Okay, this is a webinar for National Vaccine Month of Action Partners Call by Health and Human Services in the United States. And today is June 28th, 2021. And it is 5:30 p.m. Eastern Standard Time, or 2:30 p.m. Pacific Time. The webinar is about to start, and Dr. Anthony Fauci is on the featured speaker on this Zoom webinar. Okay.
Thank you all for being here. I'm Ivana Cancella. I work at the Department of Health and Human Services and have been deeply involved in the month of action. Today's conversation is an important one because it gets us into our final weekend of the month of action, but what we know is not the end of the work we need to do to beat this pandemic. Today's conversation will feature Dr. Fauci and a number of community groups who have been working tirelessly not only over the last month, but over the course of the last year and a half in making sure that their communities are vaccinated. It is a pleasure and an honor to welcome Dr. Fauci into the conversation, not only because of the work he has done to lead the nation through the pandemic, but the work he's done his entire career to ensure that we are an informed, scientifically based society when it comes to all things health. Thank you so much for being here today with us, Dr. Fauci. It's really a joy to welcome you.
Thank you very much, Ivana. It really is a pleasure to be with you. To just make a couple of comments, and then I'd be happy to answer a few questions. As we all know, we are now living through our generation here, a historic outbreak, the likes of which we haven't seen in over 100 years. Fortunately for us, but unfortunately for some others who don't have what we have vaccines that are life-saving, can put an end to this outbreak, and can get us back to the lives that we had to put on hold now for well over a year and a half. We've done extraordinarily well with vaccines. We have more than one vaccine that's highly effective in preventing disease and even more effective in preventing severe disease. The vaccines are safe, and we've done very well. Since the beginning of the Biden administration, we went from 1% of the population vaccinated to 50% fully vaccinated of the adult population. More than 67% of the adult population has received at least one dose of a 2-dose combination. However, we have more to do, and that's where you all come in. I want to tell you, it's really a pleasure and an honor to be here to, one, tell you thank you so much for the work that's been done. The success of our vaccine programs depends in no small part on the work of everyone on this call. But as you just heard from Ivana, we're in the final stretch of the month of action. It's not going to end at the end of the month of action, but we really want to put all our energy into get as many people vaccinated as we possibly can as we come to the end of the month of action, so that we can get our country protected as a nation, protected as individual communities, and importantly, to protect the safety and the health of each one of us, not only because that's absolutely the most important thing we can do, but also we want to get our lives back. We want to get the country back going the way it was before, in the sense of people aspiring and reaching their goals without the hindrance of an outbreak that we're all concerned about. So it's within our power to do that. And it's because of you and the things you're doing and helping us get people vaccinated that we will be successful. So let me stop there, Ivana. I'd be happy to answer a few questions.
Thank you so much, Dr. Fauci. We have 3 different community groups from across the country who have questions today, and we'll kick it off with Melissa Leyland, who's with the Arkansas Coalition of Mashalese. Melissa, go ahead.
Thank you so much. Hi, Dr. Fauci. Great to see you on this platform. My question for you is, what can we tell Sorry, we had a technical difficulty there. Dr. Fauci, what can we tell those who are women who have concerns about the vaccine effect on their fertility or pregnancies?
Well, we have a lot of information on that, Melissa. We do. We have had tens and tens and tens of thousands of people who've gotten pregnant while they were being vaccinated, those who were vaccinated and then got pregnant, and people during their pregnancy who've gotten vaccinated. There is no indication whatsoever that there's any problem with fertility or have a negative impact on the pregnancy. The thing that is important that we should stress is that the one thing that we do know, that if you get COVID-19 during your pregnancy, it's very, very clear. It's a negative impact on the pregnancy itself and on the fetus. The mother can have an adverse pregnancy event, as can the fetus. So the best thing one can do to protect yourself is to actually get vaccinated. There's no biological reason whatsoever to think that it has any effect on fertility. And we know now, as more and more people get vaccinated and more people get pregnant, that that's not the case at all. So it's something that's out there as a myth, but it's not true.
Thank you.
Thanks, Dr. Fauci, and thanks for the question, Melissa. We'll travel a bit across the country now and go to South Dakota, where we have with us Taniza Islam from South Dakota Voices for Peace with a question. Go ahead, Taniza.
Dr. Fauci, what would you say to people who don't feel like their risk of COVID-19 is high enough to worry about getting vaccinated now that it's available to them?
Well, you can tell them unequivocally that the benefit versus the risk, the benefit of vaccination is overwhelmingly more than any risk. And one of the misconceptions that people have, particularly among young people, they say, statistically, if I get infected, it is unlikely I'm going to have a severe outcome. So why should I care? Well, first of all, you should care because plenty of young people, even though statistically less than the elderly, young people can get into trouble. There is a syndrome called long COVID, which means even after you recover from mild infection, you can have prolongation of symptoms that can actually be incapacitating. We know that as a fact, not a myth, but as a fact. The other thing that I believe is equally as important, you have a responsibility not only to yourself, but to your community and those around you. Because if a young person winds up getting infected, even if they don't have any symptoms at all, they could inadvertently and even innocently pass the infection on to someone who might have an adverse event. And I don't think anyone would ever want to be the vehicle of hurting somebody else. So your responsibility to yourself, but your community and communal responsibility to those around you. They may be your relatives, your loved ones, but they may be just people in the community. That's the thing you have to consider when you want to get vaccinated. It isn't only about you, it's about your responsibility to your community.
Thanks, Dr. Fauci. I think that's such an important message. And we have one more question from Justin Lowenthal with Doctors for America. Justin?
Dr. Fauci, it's wonderful to see you again. In our work promoting vaccination, our doctors and health workers around the country are hearing a lot of fear based in misinformation that our patients are hearing in the media and on social media, leading some to be not just hesitant, but truly resistant to vaccination. And so I'm wondering, in your view, how do we best combat that misinformation in various media outlets and on social media platforms?
Justin, that's a great question. And that's one of the reasons why I am here speaking to all of you, because the best way to counter mis and disinformation is by correct information. And correct information from people like yourself, who are trusted members of society. So the more important, correct information we get out, that's the best way to counter misinformation and disinformation. And that's the reason why I take a lot of pleasure in getting on programs like this and congratulating you all for getting the correct message out there. It's very, very important. So thank you for what you're doing.
Thank you.
Thanks, Dr. Fauci. And those are our questions. I'll open the floor for you to give some closing comments, and then we'll keep hearing from different groups.
Well, thank you, Ivana. First of all, I want to thank you for giving me the opportunity to be here with you today to not only bring out the importance of vaccination for our individuals, our community, and our nation, but also to sincerely thank all of you for all you are doing to get people to be vaccinated and get to the goal that we all want, is our own safety, our health, and to get back to normality. Thank you very much for having me.
Thank you for all you've done and for all you do. We, as a nation, owe you a debt of gratitude. Thank you.
Thank you. Take care.
Thanks. And with that, I'm going to turn it over to my colleague Haley. My colleague Haley from Made to Save. Haley?
Awesome. Thank you so much, Ivana. Thank you, Dr. Fauci, as well. I'm really excited. You all have heard a couple of questions from our partner features today, but I'm really excited that you can hear a little bit more about the incredible work that they are doing. So we are going to go back to Melissa to talk a little bit about her work and her team's work at the Arkansas Coalition of Marshallese.
Again, this is Melissa Leland. For whatever reason, I'm having difficulty with the camera, so I apologize if my picture is actually coming in later. But I will be bringing the story behind what's going on with the Pacific Islanders within the state of Arkansas, around particularly the Marshall Islanders who have migrated to the state of Arkansas within the past 25 years. If you don't know where the Marshall Islands and the history of the Marshall Islands is actually from 1946 to 1958, there were 67 bombs that were detonated on the islands by the U.S. military. So I usually bring that up because people often relate to that. So what the Marshall Islanders have really migrated to Arkansas, and they have found jobs as essential workers. So they're very important part of the economy. They accounted for 3% of the population in Northwest Arkansas, but make up 19% of active cases in June 2020. Over 43% of the region's hospitalization were from the Marshallese community. And at one point, the death rate from this particular Northwest Arkansas region, the Marshall Islanders were accounted for 50% of those death cases. And also another thing is because the Marshall Islanders did not have access to federal program, just as the Medicaid program, the health issues were already heightened prior to the COVID-19. So the COVID-19 actually just magnified all the health issues that even exist before that. But what we found in this, that's why it's very important for us to mobilize and really to push forward this COVID-19 vaccine. So what we have created is really this network among and really strengthen the community, the communication power between healthcare providers and community organizations. So we have created, working with our Consul General and one of the only two doctors that are qualified to practice in the United States from this specific population, we have worked really closely with him and the Consul General to create what we call the Marshallese COVID-19 Task Force. But ACOM is also part of the Pacific Islander COVID response team that's led by Dr. Nia Aitoto. So we have really put ourselves into where the resources are, so that way the resources flow directly to the community and doesn't go anywhere else. Because I know that oftentimes resources really mean a lot. We've also worked with the Arkansas Department of Health to coordinate for their staff to visit people at homes. Oftentimes we have issues with transportation, So instead of waiting for the community to come to us, we also go with them, go to them and go to their homes. Another pillar that is very important is the church. We organize for us to go and visit the churches and provide these vaccines. Messaging is very important. We use our influencers in the community. We also ensure that the folks that we're hiring are what we call community health workers that speak the language. That's very, very important. And I think that's important in terms of vaccine equity. Sometimes there are counties that have not disaggregated their data, so oftentimes it's very difficult to really come up with the accurate number of people who have, Pacific Islanders who have received the vaccine. The work to increase awareness and to provide education to any community who's limited English proficiency is very important now. What we had the Marshallese experience from April to July 2020, we don't want that to happen again. So we want to ensure that all of our work and our energy really put into this COVID-19 vaccine. Thank you.
Thank you so much, Melissa, and thank you for all of the work that you've been doing to ensure that the Marshallese community gets vaccinated and has the language resources and other resources necessary to make that possible. Now I'm going to turn it over to Taniza from South Dakota Voices for Peace to tell us a little bit about her work.
Sorry, my screen is yellow. It just doesn't want to budge. But thank you to Made to Save for lifting our work during this month of action and giving us this opportunity to share the dynamic work our team at South Dakota Voices for Peace has been engaging in for the last year. I'd like to paint a picture of South Dakota. Geographically, we are 16th in size, close to 76,000 square miles. Out of 310 cities, our largest city is nearing 180,000 people, and 231 of our state cities have populations of less than 1,000 people. Our largest industry is agriculture, and we are an English-only state. We are a rural state where immigrants and multilingual communities are often unseen and unheard. With the COVID-19 pandemic, South Dakota Voices for Peace started building trust in rural, immigrant, refugee, and undocumented communities through an emergency relief fund we built and administered. And now we are working to provide accurate information to South Dakota's multilingual communities about the vaccine so they have the power to make informed decisions. We are also working to make the vaccine more accessible in these rural communities. First and foremost, we really appreciate the Biden administration's shift of monies from going directly to government agencies to also including CBOs on the ground who work directly with impacted communities. South Dakota is an English-only state. Funding organizations like ours has been critical in rapidly translating material in multiple language in a state that doesn't have this infrastructure. Our work includes sending multilingual outreach teams to meet communities where they are, to provide information on the vaccine, help answer questions, demystify the process, and most importantly, build trust in the language. Our model is not just to go once, but go several times before we ask multilingual community leaders where we can have pop-up vaccination sites in their community. Community leader buy-in is critical in building trust with the rest of the community, and this important work also takes important time. Through our work, we have found that rural immigrant communities want to receive the vaccine, but are not sure where to access it. We have also found that many big employers with multilingual workers here in South Dakota, that includes dairy farms, meat processing plants, and the hospitality industry, do not believe it is their responsibility to get their employees vaccinated. We are trying to make this connection for employers too. that a COVID-free workforce is a more productive workforce, and that their encouragement may be the next step in assuring our community's safety overall. It may seem simple, but we are the first community-based organization in South Dakota having these conversations and building the trust needed to get more shots into the arms of our multilingual rural communities.
Thank you so much, Tanisa, and thank you for the emphasis on building trust. I think that we are seeing across the board that is so critical, and having the right resources only matters if we can build those relationships and really build trust within the communities. So thank you so much for all of your work. I'm going to pass it over now to Drs. Mina and Farheen from Doctors for America, who are going to tell us a little bit about the work that they are leading.
Thank you so very much for the opportunity to present the work that Doctors for America has been doing during this month of action. And DFA is a nonprofit of physicians and medical students dedicated to really putting our patients above politics and increasing the voice of healthcare workers in advocacy. And as healthcare workers, we've really experienced the burden of this pandemic firsthand and have felt the responsibility to get out there and work again on the front lines to get folks vaccinated and end the pandemic. Quite simply, all Americans are our patients. So one of the highlights of this past month has actually been partnering with Made to Save on a series of what we called house calls. These were phone banks designed to specifically mimic those good old-fashioned doctor house calls that probably none of us have ever experienced, where a doctor comes out to your house and addresses your specific concerns. And so we were targeting low vaccinated states and counties, calling folks one by one to ask them if they and their households had been vaccinated. And if they hadn't been vaccinated, asking them why, what were their concerns, answering any questions they might have, and really targeting to help them get themselves or a loved one vaccinated in the next week. And so far, we've had 4 of these events. We've involved nearly 70 medical students, doctors, nurses, respiratory techs, had over 600 conversations, specifically talked directly to 200 unvaccinated individuals, and then many, many more who were vaccinated but said, someone in my household just doesn't feel comfortable with this. And then every time we got a vaccinated person, we'd ask them to please reach out to 3 more people in their community to see if those folks have been vaccinated as well, so that hopefully one by one, conversation by conversation, we cast this network of folks who are getting out there to get folks vaccinated. Now, as Justin had mentioned during the questions, running counter to this has been a significant rise in misinformation regarding the COVID vaccines. And this has really made our efforts much harder. And so to address this, we partnered with another nonprofit of Oz and put together a counter video. We had nearly 24 physicians saying, yeah, this has been a really scary time, but vaccines are safe and they save lives. And I've gotten vaccinated, and I want to help you get vaccinated too. And I think there may be a link of this video that you can share. We'd love it if folks could share it widely. Along with this, we put together a frequently asked toolkit that we started with the first vaccine, a nonpartisan resource that folks can go to for the most common questions, and a lot of resources that can counter that misinformation and just help folks feel more comfortable with their decision to get vaccinated. And now I want to turn this over to my committee chair, Dr. Farheen Qureshi, to talk a little bit more about some other campaigns we've launched.
All right, thank you so much, Mina. I'm just going to tell you guys about something we call the Rock the Vaccine campaign. We are mobilizing our over 20,000 doctors and training members to engage folks around them in different ways. That includes the house calls that Mina was just talking about, talking to their patients, talking to their patients' families, and engaging communities. And all of those members who do engage others in that way will be getting a DFA Rock the Vaccine t-shirt to support their support for the vaccine even more. And then, lastly, we are working at the state and the local level, partnering with Made to Save, partnering with US PERG, other grassroots groups, and we're always looking for opportunities to partner with other like-minded organizations. So if anyone on the call is interested, please feel free to reach out to us. We are at info@Doctors for America, and that's drsforamerica.org. Thank you.
Awesome. Thank you so much. I've heard so many good stories about the house call phone banks. It's just a really fantastic concept, and we're grateful to have champions in healthcare who are out there mobilizing folks to get vaccinated as well. So thank you so much to all of our partners for being on today, telling us a little bit about the important work that you're leading. I know that many others on this call have been doing fantastic work throughout the month of action and long before the month of action, and will also be doing that work long after the month of action is over too. So I just want to extend my deepest gratitude and our deepest gratitude to all of you for the work that you're leading. I'm going to see if I can share my screen really quickly. Bear with me for a second here. And hopefully folks are able to see my screen. This is your daily or your weekly update on some of the things that are happening with Made to Save. We are rolling out a really great app this week to support in relational organizing and community canvases. We have a training for volunteers both tonight and Wednesday, and I have the link here where you can register. If you're interested, it's a really great way that to facilitate those conversations and make them as easy as possible for your volunteers. So I would definitely recommend checking out these trainings and learning a little bit more about the REACH app. If you have questions about hosting an event for the month of action, you can join our host training on Wednesday or our office hours tomorrow or Thursday. We're happy to answer any questions that you have or talk through ideas. And Made to Save is also hosting a phone bank and a text bank this week for organizations and volunteers that will not be hosting their own events. So continues to be really important. Every single conversation has the potential to have a huge impact. So please check out these different opportunities. And here, please make sure, if you haven't already and you're hosting events, to fill out the partner commitment form at madetosave.org/MOA. If you are hosting events, you can register them at madetosave.org/register. And then after you've hosted an event, make sure to tell us about it. It's really incredible to hear the stories, anecdotes, highlights, and then those important statistics about conversations. You can go to madetosave.org/reportback. And all organizations that report back through this form will be receiving a commemorative letter from President Biden, thanking you for all of the work that you're doing. So please make sure to get this information to us as soon as you can. I believe that the deadline will be next Wednesday to get the final reports in from the month of action. So thank you so much, and I think I'm turning it back over to Ivana. I'm just so grateful to be here with you all.
Thanks, Haley, and thanks to all of our participants today. It is so inspiring to hear about the work happening on the ground that we know all of you on this call are doing. It is true that on July 4th, what was a month of action will come to an end. But it is also true that on July 5th, the work continues. And it continues in communities, it continues on our TVs, it'll continue across our screens, because the work of making sure that every American who can get a vaccine gets one and gets their full dosage is something all of us are a part of. And it's important not only to have those conversations with our friends and family, coworkers, colleagues, really anyone who will listen to us. It's also important to make sure that when we do that work, that our organizations are reporting it back. Here at the administration, we only know what's happening on the ground because of what you all share back. And we want to be able to tell the story of how hundreds of thousands of volunteers engaged in the work to ensure that the month of action was a success. So please make sure that your organization is reporting back. Today is Monday. We still have a number of days, I believe 8 days until July 4th. And I look forward to making sure that I do everything I can to make the rest of this month a success. And I know that it will be, because we will be doing it together. Thank you all for being here today, and thanks for all you do.